Hello, and welcome to this module on Idaho infectious disease resources. My name is Dr. Nnamdi Moizeke with the Department of Community and Public Health at Idaho State University. At the end of this module, participants should be able to describe epidemiologic patterns of infectious diseases in Idaho, identify government and non-government agencies, departments, and partners involved in the prevention, harm reduction, and care for infectious diseases, engage Idaho policies and legal frameworks related to infectious disease reporting and response, and locate and use online Idaho-specific infectious disease resources. So we have categorized the infectious disease resources that we'd like to share with you in this module into 6 categories: epidemiological data and how to have access to them and utilize them, common diseases in Idaho, and Idaho infectious disease related regulations, infection prevention and control services available in Idaho, educational resources that are Idaho specific, and relevant partners and partnerships and their contact details in Idaho. As regards the epidemiologic patterns of infectious diseases in Idaho, we'd like to look first at the National Center for HIV, Viral Hepatitis, STD, and TB Prevention, which has an interactive tool called Atlas Plus that gives users access to nearly 20 years of surveillance data on HIV, viral hepatitis, STDs, and tuberculosis at national, state, regional, and country levels. So Atlas Plus has charts, maps, and table functions. It gives you the ability to create and download customized tables, maps, and charts using these data on HIV, viral hepatitis, STD, and tuberculosis. Using any of these functions, you can view diseases by year, geography, and demographics. So you can select Idaho, for instance, using the drop-down button for geography. Atlas Plus also provides access to indicators on social determinants of health, allowing users to view social and economic data in conjunction with surveillance data for each disease. Atlas Plus gives you quick access to nearly 20 years of surveillance data on HIV, viral hepatitis, and sexually transmitted diseases and tuberculosis. So Atlas Plus has diverse data characterization capabilities, including line graphs by year, pie or bar charts for sex, bar charts for age group, race or ethnicity, transmission category, as in the case of HIV, and country of birth when it comes to tuberculosis. So bar charts by states or by counties are also available. So it also has the ability to create 2 side-by-side maps or charts, for example, to compare 2 diseases or 1 disease and 1 social determinant of health indicator. So Atlas Plus is convenient. You can get the data when you want, and all with a few clicks. It's also quick to use. You don't have to rely on someone else to compile and send you data. And it's easy too, because you don't need to sift through pages of surveillance reports. It's also social, and very social, because adding the Atlas Plus button to your website makes it even easier to access and share this powerful tool. Next, we'll look at the common infectious diseases in Idaho. The Idaho Department of Health and Welfare has a list of the most common diseases in the state. It provides resources for their management and prevention. Of course, this list of diseases in general includes infectious diseases. And as we can see on this screenshot of their website, that the most common infectious diseases in the state are HIV/AIDS, COVID-19, cytomegalovirus infection, hepatitis, viral hepatitis, tuberculosis, West Nile virus, respiratory syncytial virus, and very importantly, sexually transmitted diseases. So this website provides list and then resources on how they are managed. We'll look at Idaho infectious disease regulations, and then we would like to emphasize the Idaho reportable disease list and the Idaho reportable disease rules. Healthcare providers, laboratorians, hospital administrators, school administrators, and persons in charge of food establishments must report the diseases on the list to their local public health district or the epidemiology program within the Bureau of Communicable Diseases in the Division of Public Health of the Idaho Department of Health and Welfare. And this reporting must be done within specified timeframes as per the reportable disease rules. So the rules contain the official requirements governing the reporting, control, and prevention of reportable diseases and conditions, and the requirements to prevent transmission of health hazards. Infection prevention and control services in the state, and we'll be looking at the healthcare associated infections program of the Idaho Department of Health and Welfare. This program aims to reduce the risk of infections and complications of individuals receiving healthcare in Idaho. And the Idaho Healthcare Associated Infections Program is federally funded to support healthcare facilities in preventing and responding to healthcare associated infections and antibiotic-resistant pathogens. So the full list of all the services they offer and how to access them can be found on the website of the Idaho Department of Health and Welfare. Educational resources are also available and are Idaho specific. So the HAI programs educational resources we'll look at first. The Healthcare Associated Infections Program aims to reduce preventable infections across Idaho by offering free and accessible education on infection control principles. The HAI program offers infection control educational resources for a variety of audiences and topics to reduce the risk of infections for individuals receiving care in Idaho. And the list of trainings, events, and resources are available on the IDHW website, which will provide in the resources of this for this module. And next educational resource, which is very important also, is the Idaho Disease Intervention Basic Training. This is a free online asynchronous course on disease intervention and public health. The training educates learners about public health and disease intervention through the lens of disease intervention specialist work, a public health profession that entails contact tracing, partner services, and case investigation to address the spread of diseases, most commonly sexually transmitted infections. So the goal of this training is to educate Idahoans on disease intervention and encourage interest and competency in public health work. Of importance is partnerships for infectious diseases in Idaho, and it would be nice to share this resource too. Firstly is the Idaho Health Alert Network, which has a system that is automated and designed to rapidly deliver time-critical health-related information to designated health partners. So when a health threat is identified, the Idaho Department of Health and Welfare sends an email or short message service or text message to district public health departments. And the district public health departments pass this information on to hospitals, clinics, physicians, and other appropriate healthcare providers. So in addition, information on the Health Alert Network website summarizes the event and provides background and guidelines for public health staff and clinicians. And you can go ahead and register and apply for access to this network on the website, which is provided also as part of the resources for this module. Another group of partners is the Idaho Public Health Districts. And Idaho Public Health Districts, as independent agencies, Idaho's 7 health districts are primary outlets for public health services. They work closely with the Idaho Department of Health and Welfare and other state and local agencies. Their addresses and contact details are also provided in this module. And last but not the least is the Idaho Collaborative for Infectious Disease Prevention, and on whose platform this module is being presented. So the Idaho Collaborative for Infectious Disease Prevention has a vision to build and maintain a compassionate health workforce in Idaho with the capacity to effectively address prevention, harm reduction, and care for communicable diseases, especially in underserved communities. And the mission of this collaborative is to be Idaho's leading interdisciplinary team and eventually a center which is engaged in building interprofessional partnerships. Thank you very much.